again, uh, what I know is that most of the labs, they will use the the glucometers. The glucometers are measuring blood, or rather testing blood from the capillary sample, and you see the ranges are mostly in reference to plasma glucose. So unless this glucometer is maybe internally it has been programmed to recalculate that value into plasma glucose, then there could be some errors in your diagnosis. However, there are other, although WHO hasn't released a factor yet, but there are other platforms, other hospitals, research centers, which have been using some factors. Some have been using 1.1, some are using 1.13, that is converting capillary blood glucose into plasma glucose. Now, however, the fasting capillary glucose is always the same to that of fasting plasma glucose. I think this is based on the fact that at fasting, then there is some glucose homeostasis, that is, there is balance between glucose in the tissues and in the veins. But after taking some meal, then it means the body's glucose homeostasis is interrupted, and there is always need for the tissues to absorb more glucose while the vessels keep on transporting more glucose to the tissues. So there is always a slight variation. Now, maybe we can move to oral glucose tolerance test. Oral glucose tolerance test is done to children, adults, and adults we have non-expectant and expectant adults. That is, and all of them will be given glucose with different quantities. Like for adults non-expectant, we are supposed to give 75 grams dissolved in around 250 to 400 mLs of water, and you ensure it is dissolved properly. And then for children, it is recommended you take 1.75 grams per kg. So it means you first have to take the measurements of the weight of the child, then the maximum is 75. So you make sure you calculate. If the baby is 20 kgs, then it means you are going to say 1.75 times 20. If the child is maybe 27, then you take 1.75 times 27, but you ensure that the maximum limit is 75. If it is around 70, your calculation brings you to 80, then just go back and use 75, just like for an adult. For pregnant women, we use 100 grams. And now we need to have some preparations for this test, because it is obvious most of the labs are making mistakes in diagnosing this. Now, there are preparations. At least the patient should be 3 days on unrestricted carbohydrate meal or diet and activity. And I think this is important in maintaining the glycolytic and gluconeogenetic genesis balance. Yes, so that you see, if you are denying yourself glucose, then you might destabilize, or rather interfere with the normal body glucose metabolism, and this might bring false results. There should be no medication on the day of the test. Yeah, don't take any medication because it might interfere, like maybe those ones taking drugs for anti-hyperthyroidism drugs. You see, those are drugs that could interfere with the tests. No smoking, no smoking, and you should actually also fast for at least 8 to 12 hours. And now also there are interferences of OGTT which should be known and which should be taken care of. One, anybody from a major surgery should not conduct OGTT. People with myocardial infarction, stroke, and infections. So you see, these are the mistakes we usually do in the lab, because the sugars are suggestive. You recommend for OGTT, then the clinician or the doctor wants the results tomorrow. Remember, the criteria, or rather the preparations, are not met, and then we have not taken care of interferences. Because infections, myocardial infarctions, I think myocardial infarctions is the fact that when you have a myocardial infarction, then it means some parts of your tissues are not receiving sufficient nutrients and oxygen, so there is tendency of an imbalance. Then some steroids or drugs such as steroid stimulants. So you can imagine some stimulants or steroids will make you feel, it will increase your appetite, and appetite means some metabolic responses or triggers have been altered with, and this is the same that will happen to your glucose metabolism. Stress and nausea. Yeah, if you are stressed up, then even your metabolism is interfered with. If you have nausea, also you might have interfered metabolism. And all said, there must be what we call patient satisfaction and acceptance, because you'll discover most of the time our clients are not ready to pick up the fact that they are turning diabetic or they are diabetic. So it is always important to explain all the processes to the patient and make him or her understand and appreciate the process. Ensure that all interferences are eliminated, and this is in reference to pre-analytical, analytical, and post-analytical errors. Instead of typing 7.8, you are typing 8.8 or 8.7. This can be disastrous, and this can bring issues with your client. So ensure all those errors are eliminated. Always work with some consciousness that actually you are doing a very serious decision to this particular patient. Another important thing about patient satisfaction and acceptance to result is, if one technique does not satisfy the client, then you can always consider using another technique with his nodding. Yes, ensure that he or she understands that actually, because of the other test she's not very well satisfied with, then it means you can always have another test and make her or him understand that you are doing this so that you can really confirm that actually the patient is diabetic or not, because he may also in doubt that is diabetic and you are saying is not, so you must also consider that. I think up to that level we have discussed something, and we are going to get into more and more discussions which will be very beneficial to you. I'm reminding you once again, you can subscribe, share, and you can always be viewing these videos so that you can have something to tell your friends, your family members, and others. And also remember, uh, information not shared is just as good as dead. Karibuni sana, welcome, and I think from there we are going to meet next time, and I'll be sharing the email where you can always email me your concerns so that we can discuss in detail. And I'll be also be welcoming other professionals in this forum so that they can also be sharing with us their experiences in all the topics that we are going to have in this channel. Remember, the channel is Lab Chat, LAB Chat, CH@NT. Yes, you can start subscribing and sharing widely so that we can move forward. Thank you very much. Asante sana.